Subscribe now and press the bell icon. Never miss an update.
नमस्कार जी, बहुत बढ़िया। आप कैसे हैं? अरे
How are you, sir?
बहुत बढ़िया, बहुत बढ़िया।
Pleasure having you
Very
here
nice
again.
to see you again.
Welcome back to India.
Very nice to see you again as well. Thank you. John Nanda from my office, and Gary is.
Sir, this is a unique facility in India where you will see homeless, and what we do at night, we send our vehicles, we call it a rescue van. They go pick up users from different parts of Delhi. We bring them here.
The last time the pictures you gave us,
Yeah.
we have put them in the White House and prominently on the wall.
Thank you.
And I'm going to see if John, while we're meeting, will call somebody there so they can take the picture and send it in an email back so we can share with you.
Thank you, sir.
Yes,
Thank you.
yes.
Thank you. Thank you.
Homelessness.
And long-term rehabilitation at night. And they can stay here as long as they want. No question asked. But if they want to have anything, they have to be part of the treatment program. Food, nutrition, all these things are provided free of cost.
Right.
But the moment you want something extra, then you have to be part of the treatment
And how long can they stay here?
as long as they want.
You may want to come experience this as well as maybe take pictures. So, people here can come off the streets, get shelter and food. But if you're on next level, they have to get treatments. Homeless, like people in America don't like to use the term addict.
Okay.
They say people with addiction or substance use disorder. So because it's stigmatizing.
Yeah.
So they always, maybe the thing is that homelessness might be stigmatizing. So unhoused is better. But the conflict
I think that is better.
Yeah, but the conflict is that home is about more than building. It's about family, values, connection. So once we start using terminology of just house, then it's difficult. So it's a challenge, between the two sides. So
Right. Our night rescue is very important.
night rescue.
We start somewhere from 15th of November till 15th of March. And we have 3 other shelters. Those who are not in addiction or those who want to be on long term, we have another place called Sarai Kale Khan. So they stay there, some of them have addiction and cancer. So they need a specialized support. Someone is TB patient and plus the cancer. So, so for that we have a special center. And again, that's a unique, only of its kind in the country.
Wow. Yeah. Right.
The ART leakage is also part of our program. Hep C treatment is part of our program. TB is part of our program.
स्टिचिंग एंड ब्यूटिशियन की क्लासेस होती है।
अच्छा अच्छा।
वेस्ट मटेरियल से ये लोग बनाते हैं।
ओह वाह।
मैट के ऊपर ये पर्स बनाते हैं।
तो इसको फिर उसको बेचते भी हैं
हाँ,
क्या? दिवाली पे जो
थोड़ा अर्निंग भी हो जाता है इनके साथ।
जी बहुत बढ़िया।
SPYM, the NGO which manages the homeless,
Yeah.
and there is this addiction clinic which is supported by Addicts. This is where the registration takes place of all the patients. Once they are registered here, a file is created.
Okay.
This is our team. Dr. Manmeet is our senior resident. She's pursuing her DM in addiction psychiatry. Been our student in MD psychiatry and now pursuing super specialization in addiction psychiatry.
CMS. Okay. Very nice, very nice. It's good. You're having people who are interested in pursuing addiction psychiatry. It's a very big need.
So the patients are seen here as by their doctors, and then once they are put on medications like buprenorphine,
Yeah.
that's Megha is our counselor, and then we have our nursing staff for dispensing.
Okay, wonderful. Great.
Quite a few patients of buprenorphine, at least in the initial few months,
Yeah.
we insist them on coming daily, every day
Sure.
for their observed doses.
Okay.
And once they spend some time, once we are sure of the compliance and so everything, that's when they start getting about 3 or 4 days medicines at one go for carrying back with them. Mr. Dinesh is our medical social welfare officer. Like all other places, we also have NIMBY syndrome here, not in my backyard.
Yeah, of course.
So once in a while, we do get complaints from the community.
Yeah.
And then when we tell them that a large majority of our patients are from your own neighborhood.
Yeah.
By providing them treatment and shelter here, we are keeping the neighborhood safe.
Right.
That's when they realize, no, that's a big important thing which is happening here.
Yeah. बाहर प्रचार भी करना पड़ता है इन सब जाके बातों तो प्रचार में कोई तकलीफ भी होती है
It's a part of job.
SPYM का टारगेट इंटरवेंशन प्रोग्राम भी यहाँ पर चलता है साथ में जो हम इंजेक्शन द्वारा जो नशा लेते हैं उनके साथ हमारा प्रोग्राम चलता है। तो ये हमारी टीम है आउटरीच वर्कर।
चैलेंजेस क्या है इसमें
चैलेंजेस ज़्यादातर वो चकारी बहुत करते हैं तो कभी बार ऐसा भी लगता है, डर भी लगता है अकेले जाने में कि फ़ोन ना ले जाए, क्योंकि ऐसा हमारे एक आउटरीच के साथ हुआ है। वो उन्होंने कहा भैया कॉल करना है, फ़ोन दिखा दो, कॉल करने के लिए फ़ोन दिखा तो फ़ोन लेके बोल दो। लेकिन हम ऐसे फील्ड पे जाते तो ऐसे बॉन्डिंग बनाते हो, हम पहचान हो जाते हैं कि भैया ऐसे ऐसे एनजीओ से ऐसे।
He's sharing that.
Yeah, this is a completely different sort of target audience, and it's the adults. And as you can see when you were driving in, it's the old India from the 1970s with the cows, etc., and a highly impoverished, drug sort of riddled area. So clearly the sites, which is an important thing, are created in places where there are concentration of drug users, giving you a general overview of the different types of services that have been provided from children in conflict with the law and drugs. Then we have the Women's Centre in Daryaganj, which I think you know that area. And then we have the boys, the under 18 boys centre. Then we've got the adult centre. And then we've been expanding, I think we mentioned it the last time, of this thing called Navchetna, where we're actually introducing drug education into the schools. The curriculum. So now it is up and running. The Ministry for Social Justice, in terms of really rolling it out in a way that we can get down to the district level. So it's with the SERTs, which are sort of what we're doing with the master training programs. But this is all really getting into, let's raise the profile of drug education with young people from standard 6, so they're usually 12, to basically standard 11. So it's a good wide range of children.
And this is also digitalized. Like every activity has a digital video. Yeah. And the ministry says 1 million teacher and 50 million students. We are going to reach out in next 2 years.
Yeah. My office in the United States has worked with the Department of Education and Secretary, and we just released a entire thing signed by him and me to go to all the schools in the United States, which is very similar to this, but not as comprehensive, but it's. Second, we've done some similar education work with Mexico. So the prevention curricula for Mexico and the United States, we're trying to focus together on, especially Spanish-speaking population. Third, earlier this year, United States launched a global coalition against synthetic drugs, of which India is a huge part, and it is leading a lot of the work. And I think something like this could be a really important part of the public health aura to share with. And now we have 120 countries and international organizations like WHO. And this is something we had talked about last time. So to use that fora to share this information and the work would be great. So that gets to much more international audience, and then us, of course, working with the Ministry of Social Justice and Empowerment.
In Tihar prison, we are managing a center within that jail number 5, and we call them child only. So what is happening? This child or this individual, the person can be released in 10 days time also, could be released in 1 year's time also. So the moment someone comes out, they give them a phone number and the address. That if you do not have any space, do not have any place, just reach out to this. And if you do not have money, they will reimburse your auto. So this is a unique arrangement. And then they stay with them for 6 months, 3 months, 1 month. They also find a job for this individual. If someone is a drug user, there is a treatment center within this place. Then link them with the ART if someone is positive. All those things post release from prison. Again, this is a very unique thing which needs to be sustained. And let me also acknowledge, of course, from INL, Brian, Rob, they have been supporting us more technically. We had a project which is now just over. That on sunshine evaluation, and the outcome is very good. Professor Henry Jones, she was the PI. It's very, very positive, and we hope that INL will organize some dissemination in US, because this is for the children 7 to 12 opiate user.
Drug scene is dominated so far by number one, cannabis, of course, marijuana, and opioids. Right. Of late, we see the stimulants also making entry in the form of amphetamine type stimulants, meth, crystal meth, and its cousins. Cocaine has never been popular because it's very expensive in India. So the prevalence of this meth or crystal meth is so low that in the traditional surveys or epidemiological methods, it's very difficult to capture it. So what would be required is a very focused kind of efforts to surveys which target only crystal meth or the stimulant users, and find out more about their own lived experiences, dynamics of the market.
Got it. So we have organizations in the United States that do that.
Right.
And they're experts who study sales, buys, prevalence of use, characteristics of people, so people like that. So we will be happy to talk to our colleagues in INL. Also, at NIDA, we've talked about that before. See what we can do, definitely. In the United States, same thing. We did the same exact thing since 1980s, and now it's in this administration we're coming to an understanding that wasn't a really good way to address the problem. So we're investing. It used to be 90% of the budget went to law enforcement, and 10% to health. And today, our office, $43 billion, 57% goes to health.
Great.
And 43% to law enforcement. So it's been turned around. No, absolutely. I think this is really important. I mean, this is exactly why we put this global coalition. And countries like India are at the forefront of addressing it or not.
I really appreciate you taking the time to share with us. And it's the fact that you've got, so many different aspects of care, from the homeless as well as the treatment, the inpatient, and talking on the education. It's great to see something that touches on all the aspects, and hopefully that resource aspect can be addressed, as well as the getting over the denial of the problem.
I think that with the India-U.S. relationship, we have a lot to learn from you. And maybe you can learn from us. Collectively, we can do things together, because you're right. The United States looked at it the same way you did. And look at what's happened. It's undermined the whole society. It's a national security threat because the workforce is being decimated. And it sounds like you're being proactive. You're doing more prevention. And that's the way we should have done it, but we didn't. You're learning from our mistakes and you're implementing here, and I hear the call of, the urgency of it. And so hopefully there'll be an awakening of this issue to get ahead of it, so that what happened in the United States will not happen here in India. And you're on the front line, and I'm just very thoroughly impressed with your work. Thank you.
Maybe we want to, because that is one that obviously we support, and we want to make sure that we're aware of that. So we will. So this part of this, and the second piece that we've discussed is obviously research, and the third is the education in schools. So those three big things, basically.
Thank you.
क्या नाम है आपका? चलो,
My name is Rahul Gupta.
रोहित कुमार, बहुत बढ़िया रोहित
So
कुमार.
he's our cook now.
Cook, अच्छा.
अब वो
बहुत
साथ में पढ़ाई भी कर रहा है यहाँ पे, और जॉब भी कर रहा है.
क्या पढ़ रहे हो?
सर पढ़ाई छूट गई थी तो अभी 10th
बहुत बढ़िया, बहुत बढ़िया.
डे में ट्यूशंस भी जाता है और साथ में यहाँ पे काम करता है और फैमिली को सपोर्ट भी कर रहा है.
बहुत बढ़िया.
सो ये तीनों हमारे साथ काम कर रहे हैं. ये राजेश है. ये हमारे पास गार्ड काम कर रहे हैं.
अच्छा.
रिकवरी में है, अपना ट्रीटमेंट
बहुत
भी कर रहे
बढ़िया.
हैं. ये तीनों सर.
This is the program.
सो ये 4 प्रोग्राम है हमारे बिल्डिंग में. ये इनका जो रिहैब सेंटर जो ये फ्लोर है, और ये सर्विसेज हम देते हैं. सर साइको सोशल असिस्टेंट, फैमिली काउंसलिंग, फैमिली से मिलवाना जो उनका ये एम्स का प्रोजेक्ट है.
Oh my. Oh my goodness, so beautiful.
And we're trying to get pictures to be mailed. We will email it.
So you're going to Jammu?
Thank you.
Thank you, sir. Pleasure meeting you again.
So,
Right. No,
So I've got your contact.
just remind him of CND that we need to work in.
so we'll hopefully see you.
See you, certainly.
And so much thank you for all the work you do.